course, we have Dr. BBL here, Dr. Belgobin from Minnesota. He does a lot of liposuction for women to do their BBLs and shape their behinds nice. He and I are teaming up with this, utilizing the filler formula, the permanent filler formula, to help finish the shaping of the behind with fine precision and tuning and so forth. You like this, not just personally, you had the procedure done, but you're introducing this filler into your practice to help women. Tell me
Yes.
what you're doing.
So I'm taking your novel patented filler. Saw the unbelievable potential with this. Using it for permanent enhancement, right? For the penis. I'm like, you know what? I get a lot of women who want enhancement of certain areas. Whether after a BBL, we just need to fill in like some hip dips. There's some depressions on the butt where the fat didn't take all the way. We can fill those areas in without doing another surgical procedure. There's some women who don't want a BBL. They don't want to go through surgery, or they're too thin. They just want.
Right. They don't have fat. What do you do?
I just consulted with a woman. Her BMI is 21. She is thin, thin, thin. Great body. She wants a little bit of rounding out of her hips. Not asking for much.
Maybe a couple hundred cc's
Yeah,
per side.
but where am I going to take the fat?
Right.
Right? I'm looking at
Forgot
all
about
over her
that.
body. There's no fat.
Yeah.
She wants this filler.
Wow.
So all it's going to take for me to do, safely inject filler into those little hip dips. We mold it, we shape it, we have the aftercare, the follow-up, safety, the proven results after 13 years of injecting this product.
Right.
Unbelievable.
Yeah.
A
got
new
quite market.
indication.
You have a lot of women that are going to love that.
Oh my God. That has been blowing off the doors.
Uh-huh.
Is the women.
Yeah.
Men are a little bit, skittish. You'll get the men. And I'm getting the men.
Women will pile in.
Oh my God, women.
Because they're used to stuff like that. They don't care about
They don't
discomfort
care.
or anything.
They don't
You know what I
care.
mean? They just want what they want.
And as a physician, right? A trusted physician who already does this procedure using fat, they're going to seek my advice.
That's right.
And again, saying and vetting the product that we're using, 13 years, patented, proven, safe, using over 10,000, 11,000 procedures by you.
Right.
That's all we're doing.
That's right. There's a couple dozen doctors out there using it, so we probably had, I don't know, maybe 15,000 cases done already successfully.
Yeah.
There's always a minor thing here or there with shaping, whatever, but, there's remedies to all that.
Yeah.
We've learned throughout the 13 years how to resolve small issues and so forth, and that happens in any procedure,
Right.
of course, and so forth. So that's super exciting. You're able to use this filler to do some touch-up work when you do a lipo transfer, fat transfer into the behind.
Exactly.
Now, there's other things, I use this all over the body. Originally, I used it in the face. It's not easy to use in the face. That's another story. It works well, but you have to really know what you're doing there,
Yep.
okay, because it's permanent.
Yep.
But there's other things you can do. There's any kind of body deformity can be altered with this process, with this filler, because it produces collagen, it produces mass, and it's a wonderful thing. But you have a woman's behind that's flat, okay? You put the fat in there. You have a nice build out, but then you have your little issues.
Yeah.
And I know we're going to team up a little bit in regarding observation, right? You're allowing me to observe and so forth. And I saw the first few cases there, and it looks pretty awesome. It works super well. And this is a targeted treatment. You could hit that dimple
Targeted.
and whatever you want to shape.
Yep.
with
Patients
precision.
love it.
Precision.
Pain-free.
Yeah. Can you do anything is there anything on the legs that women might want or other parts of the body?
We do cellulite treatments. So breaking up cellulite, so if there's some waviness, but you can also use this filler to inject in the imperfections of those areas.
I'm curious about that because I was thinking about the cellulite problem. All women have it. It's horrendous sometimes. I don't know how they feel. You look at it and say, oh my goodness, they don't feel so good about it. But injecting it, and we'll talk about this in the future too, and we'll follow up, injecting it in the dermis or just sub-Q, I'm wondering if it'll take some of those waves out.
Yeah.
Okay. If it does, oh my goodness.
Yeah.
That'll be awesome. That'll be tremendous. So a lot to look forward to.
I initially looked to doing this procedure for my patients because I use fat all the time. So I was thinking, do I use fat for male enhancement? And looking and doing my research and hearing that you can get shifting and lumpiness and degradation to the fat, calcification to the fat. I'm like, there's got to be another way out here. And I have physicians that I can collaborate with who do this already, but I found you.
What was the key that attracted you to what I did?
It's permanent.
That's key. Yeah, that's right.
There's nothing permanent.
That's right.
Right? So if I'm going to charge a man $12,000 for something and it's only going to last him 6 months to a year, you think he's going to come back?
They're going to have to sell the house and the farm. That's what I tell them.
Right. And that's using all the other fillers out there that are gel fillers, which are not indicated for this either.
Well, yeah.
But
label. Yeah.
it degrades down.
Yeah. Plus, it moves.
It moves, it
shifts.
shifts. And we've seen those patients together
Yeah.
in Manhattan.
Yeah.
I want to give my patients a result. I want to give them a value, right? And as a physician, my credibility is everything. So if I'm going to treat you and I know that I'm going to give you a result, I want this result to last for you and you feel like it was worth your money to me. Because what's that's going to do? It's going to create more business for me. You're going to refer patients because you're happy.
They say this is the best investment I've ever made.
And it's going to make me happy.
Yeah.
Again, yes, the best investment in yourself.
Your mentality.
To give yourself confidence.
Oh, that's right. Confidence, self-esteem is tremendous. It's a different world. It really is.
You know, we talk about gray sweatpants season, right? I think women talk about. I think women talk about gray sweatpants season. When you have a Loria procedure, every day is gray sweatpants season. Every day, because you want to show it off.
Yeah.
I threatened my wife to say, I'm going to go in the Speedo to the pool over there. And my wife's like, no, you're not.
Oh, sure. You're going to rein you in.
Right. So just imagine that kind of confidence for men.
Let me tell you this with the women's side. Okay. I had a couple. The man, of course, did a couple procedures, right? So occasionally they go out with their friends, but they go drinking and so forth. So when they were a little drunk, especially the wife, she starts talking like this. She says, "Thank you, Dr. Loria." Everyone's saying,
"Who's Dr. Loria?"
Who's Dr. Who'd you say? What, Dr. Loria? What? Thank you, Dr. Loria. And of course, he gets embarrassed.
Yeah.
And so forth. But they really, if they're allowed to speak, okay, unhindered. I mean, being drunk a little bit,
a little free.
Yeah, she tells you the truth. She was telling the truth. Say, hey, I really enjoy this type of thing. It's kind of funniest thing. The guy was embarrassed, or whatever. And I'll tell you another story. This is the opposite. There was a guy, black guy, dating this, I guess, black girl. Early in their dating, a couple weeks, and it was Thanksgiving time, and he says, hey, why don't you come meet my family, right? Okay, so maybe, I don't know, 20 people there at the table, whatever. So they were at the table, and they started eating, talking. I don't know if she was drinking or not, but she says, you know, John has a small penis in front of everybody. Unbelievable. Unbelievable. Imagine.
Wow.
Okay, such a thing. He was mortified. Everyone was mortified. How dare she? I mean, that's really not right. It's not right. But these things are real. They happen.
Yeah.
What are you going to do?
Yeah.
And so forth. So anyway, I have a lot of stories to tell. And so
forth. The stories.
But what we're going to do in the future is we'll do this again. Okay, we're going to have some discussions, topics to discuss, and so forth. And we're going to follow up on this buttocks BBL modifications and so forth. But that's going to be a dynamite blockbuster hit.
Oh my! Just the testimonials already. I've gotten so excited.
Yeah. Well, I might start doing that. I'll do some BBLs. Why not?
Hey!
No, I'm not.
I don't know.
I'll stick to generating this here, you know, these sizes.
But I love the idea that we are pioneers. You're a pioneer, right?
Yeah.
We have others in the nation that are pioneers.
That's right.
And now we're trying to pioneer a new indication.
That's right.
To treat patients who want outcomes. Using, again, a filler that you created and have used safely.
It's going to be awesome.
I'm excited.
We're going to take it to the world.
It's
We're gonna
amazing.
Take it to the world.
I am so excited by this. I talk about it every day. I talk about it every hour. My whole staff knows. My friends know. My family knows. I mean, this is...
The whole city knows, maybe. Yeah.
Well, I'm a social media guy, right? So I'm trying to get it out there as much as possible.
Yeah. You're going to be booked out quite a bit.
That's the goal.
You know what I mean?
That's the
Which is
goal.
good.
It's good.
And taking care of the patients. They're going to love it to death. I mean, imagine getting a perfect shape behind and you're able to do that.
Yep.
You put the fat in, get your basic growth, you build out.
Exactly.
And then you fine tune. It's like a
foundation.
Carpenter. You're building your house, you got your structure, and you have the
Let me give you the foundation first.
That's right.
And I can finish you. Or if you already have the foundation somewhere else, I can finish you off.
That's right. Exactly.
I'll take someone else's BBL.
And what was really important is that someone who doesn't have fat, what do you do?
Right.
Well, you got it. You got what you need.
Yep.
Okay. Well, listen, my friend, it's good to see you. Okay, we'll chat again.
Yes, for
Okay,
sure.
a lot of stuff to follow up on. And for the audience there, just keep in tune, keep in touch, and we'll have some more interesting podcasts for you.